Following on from small group teaching, problem-based learning, or PBL, describes a specific example of small group teaching which has become increasingly popular with medical schools. Therefore, a deeper understanding of this is useful for any medical educator. Problem-based learning is a type of facilitation in which a teacher uses triggers from a problem case or scenario to encourage students to define their own learning objectives. Examples of triggers might include a clinical case or test results, an academic paper, or even a photograph or newspaper article. Once the learning outcomes have been decided, students then go away and do some independent, self-directed study before returning to the group to discuss and redefine their acquired knowledge. Thus, PBL is not about problem solving per se, but rather uses an appropriate problem to increase the knowledge and their understanding. There are many advantages of problem-based learning. For example, by encouraging students to think for themselves, PBL promotes students' independence and ownership of their own learning. This prepares them for a career that will involve lifelong, self-directed learning. By defining the learning outcomes themselves, students are more invested in the learning process and formulate deeper, more insightful questions, which fosters a more engaging and stimulating learning environment. As well as helping students acquire the basic knowledge, this process also promotes the development of wider skills, such as teamwork, listening, and critical thinking. Despite these benefits, there are also some drawbacks. Problem-based learning is more demanding on tutors and educational resources than, say, a traditional large group lecture. This independence that PBL requires can be daunting for students with little experience of problem-based learning. This can result in confusion and worry that they are missing out on knowledge by not defining the correct learning outcomes. Variable student engagement in the process can also be an issue. Problem-based learning is founded in adult learning theory, in which students take responsibility for their own learning. Variation in student engagement in the process can then be a problem for the group dynamic. For example, one more confident student could take over the discussion and prevent other members of the group from contributing. In order to mitigate these potential drawbacks, good facilitation is vital to ensure the effective use of problem-based learning. Learning objectives likely to be defined by the students after studying the scenarios should be consistent with the desired learning objectives, and it is the role of the facilitator to be the guiding influence to ensure this happens. In order to keep the students engaged, scenarios should have sufficient intrinsic interest for the students or relevance to their future practice. Scenarios should contain cues to stimulate discussion and encourage students to seek explanations for the issues presented, and not just to memorize facts. And finally, PBL can be frustrating for the teachers facilitating these sessions. Patience is key, and it is important to remain the facilitator and a gentle guiding influence on the group, and not revert back to lecturing. To summarise, problem-based learning involves utilising adult learning theory to motivate the students, encouraging them to set their own learning goals and fostering wider skills. And through good facilitation, steps can be taken to mitigate any potential disadvantages.